you can believe that part? How many of you can believe in 12 days you can recover 70%? How many people of you can believe and can produce results in 12 days for 70% recovery?
जैसे हलवा बन गया या कुछ बनता है ना सर्दी में अपना लड्डू नहीं खाती थी शादी होने के बाद आई तब भी नहीं खाया ये बीमारी कैसे हो गई ये तो मैंने शुगर से तो नहीं होगी
ये शुगर की वजह से नहीं है किसी को भी हो सकता है
डायबिटीज
So how many people can believe and how many of you can prove results in 12 days? There in the chat box. Sunil and Neha, please give your number in the WhatsApp group also. Those who have doubts regarding the pain and the international fellowship group, you please give your number so that they can inquire from you and they can inquire from Vadid. Better you all people reply. Instead of me replying, you people reply, right? Because you all are experienced people. You have dealt with patients for 17 years, 15 years. You are qualified physicians. You know the indications, you know the problems. So you are the best people to answer. If I answer, it feels that I am a biased person. So that part, please keep me. And the course from 8, 9, 10 is a specific course on brain mapping. So those who want to attend that course, they must have 7 pain at least, because if you want to learn, go and practice. And from now on, we have divided the course into specialized course and non-specialized course, right? So the controversy regarding the courses will be finished. We will not be going with the deep brain stimulations, we will not be going with Parkinson's patient, we will not be going with so many things. And even we'll see how to manage the patient, because last time there was a lot of controversy. Yeah. So those patients who are cooperative, we'll treat them. Those who are non-cooperative, we'll send them. राइट सुनील, इस बार आप लोग जब कोर्स कोऑर्डिनेट करते हो तो आप लोग सीधा बोलते अगर आप कोऑपरेट करेंगे तो वी कैन ट्रीट. यहाँ कोर्स चल रहा है, राइट? वी आर रनिंग ए कोर्स, राइट? आवर सिलेबस इज इम्पोर्टेंट. आपके पास पेशेंस है तो वी विल ट्रीट यू. इफ यू डोंट हैव पेशेंस, यू मे विजिट एनी डॉक्टर यू वांट. वी आर नॉट रेस्पॉन्सिबल फॉर ट्रीटिंग यू, राइट? ठीक है सुनील?
यस सर.
पेशेंट का पहले ही काउंसलिंग कर दो.
ठीक है सर.
और जो आदमी पहले 2 दिन में ये जो वर्कशॉप का जो हॉल का खर्चा है, पहले दिन जो दे देगा उसी को सर्टिफिकेट मिलेगा. जो नहीं देगा, दे कैन अटेंड द कोर्स बट दे विल नॉट गेट द सर्टिफिकेट, राइट?
यस सर.
फर्स्ट डे एंट्री में ही पैसा देना पड़ेगा. Plus, he has to attend the course for 3 days. अगर 3 दिन अगर attend नहीं किया, he will not get the certification. You cannot buy the certificate. You cannot buy the knowledge. You cannot buy the credential. Otherwise, it is a false credential. It is a what? Malpractice. And MK Sastry will not do any type of wrong things, right?
Yes, sir.
You are not paying me my workshop fee. You are not paying me my seminar charges. I come with my own money. I go with my own money. All you are paying for the hall, which you are using, 1,000 or 2,000 rupees, including the chair, right?
Yes, sir.
सुनील थोड़ा जैकेट उकेट देख लेना, थोड़ा स्कार्फ देख लेना, वहां ठंडे दिल्ली में.
ठीक है सर.
So now I'm going to present to you a patient who are suffering from large infarct, and more than 45% or 50% of his brain was damaged. He is Mr. Ahmad, who is a local patient, and by now he is recovered by more than 65%. He can climb staircases independently, and you can see from grade 3 or grade 4 spasticity, and contracture of his ankle joint has been recovered, right? So I'm going to present this case. We have not edited anything right now. This video is of today. So it is a non-edited version, but you can see the things, right? Can you hear the voice?
No,
Can you hear the voice?
No,
No,
sir.
sir.
Yes, sir. You can hear.
Can you hear the voice of the video?
No, sir.
Yes, sir. Loud and clear.
Can you hear the voice of the video?
No,
Yes,
sir.
sir. Clear.
No, na?
No,
So
sir.
I have
Yes,
to
yes.
No,
Loud
sir.
and clear, sir.
wait a minute. Walid, how to do it? Oh, share sound, right? Okay. Can you hear now? This is MK Sastry, and we are. Can you hear the sound now?
Yes, sir.
Yes, sir.
The video is clear?
Yes, sir.
Little bit cutting, sir. No clear.
No, and no. Almost getting at Sastry Neuro Rehab Hospital. We are getting many critical cases of paralysis. Among such cases, we want to present is Mr. Hamad with left capsuloganglion infarct and large brain stroke was there few months back. He was hemiplegic. इनको large brain stroke हुआ था capsuloganglic region and basal ganglia में. So we can see that the condition was not good of the patient. Patient was hemiparesis and was not in a very good position. आया था तो अच्छा पोजीशन नहीं था ना उसका. तो अभी आपको कितना अच्छा लग रहा है आगे से? अभी तो 60-70% हुआ. हाँ, कितना दिन में हुआ ये? 12 days. 12 days. So you can say in 12 days we have recovered this patient by 60 to 70%. In between 60 to 70%, right? So he had typical subluxation. इनका यहाँ से shoulder down हो चुका था. Difficulty in walking. Grade 3 spasticity was there in this patient, and today we can see the patient is doing very good. आप walk करके दिखाइए. अब ये देख सकते हैं patient is able to walk and he can climb staircases also. अब सीढ़ी उठ जाएगी. आप देख सकते हैं पेशेंट अब आराम से सीढ़ी उठ पा रहा है विदाउट एनी सपोर्ट, विदाउट एनीथिंग. आगे ऐसे उठ पा रहा है. स्लोली. 12 days तक जैसे फेमस से लस्सी बोल रहे हैं। हाँ, दोनों को उतारो, एक साथ उतारो। हाँ, गुड, जाने दो। हाँ, उतारो। ये तो 70% आ गया बाबा, अब तो 70% आ गया।
पहले मैं सपोर्ट के नहीं करता, मगर सपोर्ट चल रहा है।
अच्छा, तो चल रहा है। अब लोगों को क्या बोलेगा कि स्ट्रोक में आप जो 5 महीना डिले किया वैसे डिले करना चाहिए, इमीडिएट ट्रीटमेंट करना चाहिए?
इमीडिएट ट्रीटमेंट करना चाहिए। शास्त्री सर के पास बहुत अच्छा ट्रीटमेंट हुआ, मेरे को 10-12 दिन में अच्छा रिकवरी हुआ।
आप सोचा था 12 दिन में इतना ठीक होगा?
नहीं, मैं तो नहीं सोचा था।
आप क्या सोचा था, कितना दिन लगेगा?
टाइम लगता समझा था 2-3 महीने।
2-3 महीने?
जी।
जो 12 दिन में जितना रिकवर हुआ उसके लिए आप क्या सोचा, कितना टाइम लगेगा?
अभी तो मेरे ये हिसाब से महीना 2 महीने में पूरा रिकवर होने का चांसेस समझो।
हाँ, आप ठीक समझ गए। 1.5 महीने के अंदर हम लोग टारगेट अचीव करने का सोच रहे, मतलब बाय नेक्स्ट मंथ आप अपनी ड्यूटी ज्वाइन करने लायक हो जाएंगे। तो सिर्फ देयर वन सेइंग कि आप कोई भी ब्रेन स्ट्रोक में केसेस को डिले नहीं करना चाहिए, बिकॉज इन एवरी मिनट यू लूज 1.2 मिलियन सेल्स ऑफ द ब्रेन। जितना डिले होते रहता है उतना सेल्स डिले होता है, एंड टू ब्रिंग न्यूरोप्लास्टिसिटी इनसाइड द ब्रेन इज वेरी डिफिकल्ट चॉइस। ब्रेन को और मसल को एक साथ कोऑर्डिनेट करना, फर्स्ट आइसोलेटेड मसल एंड देन ब्रेन मसल हैज, ब्रेन हैज टू टेक द कमांड ऑफ द मसल्स। एंड ऊपर से सबसे बड़ा बात है बेसल गैंग्लिया सब में इंफ्राक्ट होने के कारण ये में गो टू पोस्ट स्ट्रोक कॉम्प्लिकेशंस लाइक पार्किंसंस एंड ऑल। तो ऐसा बहुत कुछ सिचुएशंस आता है which we can face, lack of coordination, lack of recovery and delay in recovery, great for spasticity with massive brain stroke. You can see all these things happen. but but by God's grace this person has done very well. In 12 days of OPD we have recovered 60 to 70%. आप खुद बोलिए कितना रिकवर हुआ है?
60 से 70%
60 या 70?
65 तक समझो।
5 marks काट दिया। So you can see in 12 days 65% of the recovery has been done. It's a wonderful recovery. Patient has done very good, and we wish we will come together very soon at the very level. Brain mapping, stimulations, rehabilitation, aggressive rehabilitation, all these things are very important for the cases with stem cell therapy. Right? आपका बोन मेरो stem cell therapy हुआ ना? So all these things in regenerative medicines in combination with advanced brain mapping stem cells, all these things recover the patient in a very larger way. मतलब patient को बहुत मदद करता है, and most important part, the recovery has to come internal, not external. अगर internal recovery होता है तो ही patient faster recovery होता है. Externally और internally अगर दोनों को combine कर दे तो recovery becomes very fast, very good and stable recovery. अब जो रिकवरी आया है, अगर पेशेंट अगर इस चीज़ को मेंटेन करे तो आई थिंक ही विल नेवर गो बैक टू पैरालिसिस टू हिज ओरिजिनल स्टेट एंड विल कंटिन्यू टू बी इन रिकवर्ड स्टेज. वंस ए रिकवरी ऑलवेज ए रिकवरी. स्ट्रोक का बात ये है कि एक बार पेशेंट रिकवर हो गया, 65% 12 दिन में रिकवर कर जाना इज अ वेरी डिफिकल्ट इश्यू, बट 12 दिन में ये रिकवर हुआ 65%. वी आर हैप्पी विद दैट एंड आई एम श्योर 1 महीने के अंदर ये मुक्तम पेन एंड ये पूरा ठीक हो जाएगा. हाँ, बी कॉन्फिडेंट एंड डोंट बी स्ट्रेसफुल एंड यू शुड टेक योर व्हाट यू कॉल्ड इनर स्ट्रेंथ. अल्लाह ताला पर भरोसा रखो, 5 टाइम का नमाज दो, अल्लाह से दुआ करो कि वो जल्दी तुमको ठीक करे, हिदायत बख्शे, और अल्लाह जरूर तुम्हारा दुआ कबूल करे. फजर का नमाज दो, जरूर ठीक करेगा. दवा और दुआ दोनों जब काम करता है अल्लाह ताला जरूर ठीक करे. अल्हम्दुलिल्लाह, he has recovered very well and I pray to Allah that may he recover more faster in a better way in a very soon period. Thank you so much. So, any questions regarding this case? So, in any course, fellowship course or any course, case studies are most important, right?
Yes, sir.
So, it is a medical format that we put up the case studies, right?
सर ये स्टेम सेल्स के साथ ट्रीटमेंट दिया, अगर स्टेम सेल्स यूज नहीं किया जाए तो भी कितने टाइम में फर्क पड़ेगा
देखो,
पड़ता है?
बोलना मुश्किल है, हर केस के ऊपर डिपेंड करता है। हम लोग एक ही बात सोचते हैं कि दिस पेशेंट्स आर फ्रॉम पुअर फैमिली, राइट? दे आर ओनली ब्रेड अर्नर्स ऑफ द फैमिली। तो हम लोग अब ये सोचे कि इसको हटा के कितना समय में फर्क पड़ेगा, उसको हटा के कितना समय में फर्क पड़ेगा, वो सोचने की जगह वी थिंक दैट कितना जल्दी ठीक हो जाए उतना जल्दी अच्छा।
यस
वी कैन नॉट थिंक हाउ मच टू डिले द केस। वी आर हियर टू गिव as soon as we can sustain, recover the patient. It's just like an ICU. See, we people are working in SICU, surgical intensive care unit. We work in neurosurgery wards. We work with all these things. The only intention of our is what? जितना जल्दी ठीक हो जाए उतना अच्छा।
यस
और जो भी है उसको यूज करो, वट एवर इज विथ अस, यूज इट एंड देन सेंड इट,
यस
इंस्टेड ऑफ थिंकिंग अब क्या होगा, इसको हटाने से क्या होगा, उसको हटाने से क्या होगा। यस, बट इफ यू यूज न्यूरो एक्यूपंक्चर विद ब्रेन स्टिमुलेशन, यस रिजल्ट्स तो अच्छे हैं। बिकॉज अदर लाइक Sunil, Neha, they are not doing stem cells, right? Yet they are getting good results. Am I wrong, Sunil? Results
यस
तो
सर।
अच्छे ही है।
सर वो बेसलरी आर्टरी वाले पेशेंट को रिजल्ट आना शुरू हो गया।
देखो, बेसिलर आर्टरी इंफ्राक्ट, which is the main artery, right, of circle of Willis, उसको रिजल्ट आना चालू हो गया।
4 साल से कोमा में था सर वो।
4 साल के, कितने साल बेड रिडन था?
4 साल हो गए सर।
अच्छा
हाँ, तो कल उसका केस प्रेजेंट कर दो। कल एक छोटा सा वीडियो बना दो उसके वीडियो के साथ, और वो उसका रिपोर्टिंग और एक वीडियो बना दो, क्या कंडीशन था और कितना आ गया। फिर आगे हम गाइड भी कर देंगे, सबको मिलके बात करेंगे। इट शुड बी ए केस
ठीक है।
डिस्कशन। If brain
ग्रेट
mapping and basilar artery infarct, there's occlusion of the basilar artery, which is the main supplying artery of the brain, right? From the circle of Willis. उस पेशेंट जहाँ सारा कंप्लीट ब्रेन इज डैमेज, इफ यू सी basilar artery is infarct, पेशेंट बचता ही,
ओ
राइट? उस इंफ्राक्ट में अगर सुनील जैसा दिग्गज ने अगर कुछ अच्छा काम किया, आई हैव a very good regards for him, because he was the person when he came to me few months back. मार्च या अप्रैल में आया था ना सुनील मेरे पास? कब
यस
आया था
सर।
बेटा? हाँ, एंड 6 months के बाद अगर आप इस तरह के केसेस, वी आर एबल टू टेकल सच कॉम्प्लिकेटेड केसेस, क्रिटिकल केसेस, एंड यू आर एबल टू प्रोड्यूस रिजल्ट विद द हेल्प ऑफ NIBS, आई थिंक यू शुड टेक हिज हेल्प एंड अंडरस्टैंडिंग. When
ग्रेट
Neha can produce, you have seen the videos of Neha, right? They have done very good in voice aphasia. So they have gone one. See, what is our interest? Our interest is that our students should do much better than what we can do.
यस
On the other day, I was hearing the lecture of a former HOD from AIMS, right? And he has done, the most significant achievement of that HOD was that in a single time, he operated both the hip and both the knee of the same patient. Is a very rare surgery. Earlier, he was the founder of the bone bank in India. He went to Germany and he was the first person to learn bone bank in India. Now, not Sesadri, what you got? Sterling Hospital, all they have the bone bank, right? But he was the first person in AIMS to bring bone bank, this technology, to India. So when his fellows went to Germany, they said, sir, after 3 months they came back and then they said, sir, we have already learned this. So why should we go to Germany to learn this? We should learn something what we have not learned. And the
यस
professor was saying, the moment your ego comes, the knowledge goes away. So my always saying is that whatever I have to convey to you, I have conveyed. Now, whatever feedback you give it to me, I'm also learning things from you. It is not like you only learning, it's me also learning from. Mira is sleeping in the class, you see? देखो मीरा सो रहा है क्लास में. Mira, get up!
Yes, Tanik, sir.
You are sleeping. You see your video, you are sleeping. Mira, get up! सुबह हो गई यारो, जागो,
Kita mendengar guru.
जागते रहो. So today we'll be teaching you about spasticity, right? So, see now, spasticity is a question which everyone is asking, right? Stroke में सबसे बड़ा प्रॉब्लम क्या आता है? फ्लेसिडिटी नहीं, स्पास्टिसिटी आता है. Stroke is a leading cause of disability worldwide. Often results are progressive spasticity. The debility condition characterized by increased muscle tone and stiffness significantly impacts mobility, function, quality of life. So what is more important in post-stroke is the quality of life. The more the muscles become tight and the tiger claw like this, right? This drop, all this happens, then the recovery becomes very, very difficult. So from the beginning, your planning should be that these stages should not be achieved. यानी ये स्टेजेस पे हमें नहीं जाना, ये मुसीबत को नहीं बुलाना है. आ बेल मुझे मार वाला काम नहीं कर. So but now you are asking me why pains are required, different things are required. This slides will answer you. And this slide is what? Written by a DNB student, not by me, right? It's a MD medicine. So these things you can verify from artificial intelligence also, right? So there is nothing to hide. Everything is there in the what? Only one slide is mine, which I have added here. Rest are all from the books. The book is very big. I have made it a short syllabus for you, right? Am I clear to you? Yes.
Yes,
So
yes.
the most important part of any paralysis is to bring a functional recovery, यानी to bring the hand into the baseline. जैसा था वैसे करने की कोशिश कर. तो हाथ जैसा था पहले, अब उसी तरह से उसको फंक्शन करके वापस रिफंक्शनलिटी डेवलप करने की कोशिश करते हैं. So that is the part of called NIBS, non-invasive brain stimulation. Why it is called non-invasive? Because there is no invasion, there is no khudai, no damage inside the brain. So it is one of the safest procedure and better procedure to recover the patient. So when we speak about spasticity, it is what? Increasing of the tone of the muscles. The muscles becomes tight. But from where it becomes, why it becomes, and then we try to give more and more stretching and more and things. So we do not know the what is the reason for the spasticity. We do not know what to do with spasticity. So what we do? We destroy the cage. The moment we know what it is, we'll know what to do. So always understand the diagnostic part of anything, pathophysiology of the disease is most important in any of the cases. Am I clear?
Yes.
Yes, sir.
Yes, sir. Yes, sir. Very much clear.
Yes, sir.
Am I very fast or am my speed is good?
No, sir. It's okay.
Good speed, sir.
Your
Am I
speed
speaking
is
very
okay,
fast?
sir.
It's okay.
Am I
No,
speaking
sir.
very fast?
Yeah.
No, it's
sir.
You, am I
okay.
good?
No, sir.
Am I good for you?
Good.
You?
Yeah, good, sir.
I'm asking
Good,
you.
sir.
Am I good for you?
Yes, sir.
Good, yes, sir.
Or am I
Yes,
speaking
sir.
too fast?
It is good.
No, it's
No,
okay.
sir. It is good.
Okay, good. If I am speaking too fast, please try to control my speed, okay? So, in this presentation, you will understand how neuroacupuncture, the neural basis of spasticity, the potential of stem cell therapy, and discuss the integration of brain mapping and neuroacupuncture to address this complex neurological challenge. So it is a very complex neurological challenge because in many cases Botox is rejected. Botox injection, which is a toxin injection, which recovers, which is known for the recovery of paralysis, is challenged. It is rejected, and it is what? So how to support Botox? How to overcome the side effects of Botox? How to integrate Botox therapy with this one? So all this part we will be covering in this part. The first thing is we must understand how spasticity is developed in a human being. Am I clear to you?
Yes.
Yes, sir.
The neural basis of post-stroke spasticity, right? So here we have not mentioned much about the hemorrhagic stroke or ischemic stroke. We have just mentioned about a stroke, right? We call it cerebrovascular accident. So post-stroke spasticity arises from the damage of the motor cortex, right? We understand the motor cortex is the line between the central sulcus and the precentral sulcus, the gyri which is between the central sulcus and precentral sulcus on the prefrontal lobe of the brain is called the what? Motor cortex, right? It is called the motor cortex. So the spasticity is and which is the reason for the voluntary movement. जो हाथ और पांव का जो movement होता है वो motor cortex define करता है, right? The execution यानी order pass कौन करता है? Principal secretary pass करता है. तो principal secretary कौन है? Motor cortex. Decision making prefrontal cortex. मंत्री हो गया prefrontal, executive authority हो गया motor cortex, right? Ministers never take decisions. They make policies and it is executed by the bureaucrats, IS officers, right? This damage disrupts the normal inhibitory signals from where the brain to the spinal cord and leading to the overactivity of the lower and motor neurons. So now you can understand both upper motor neurons and lower motor neurons are involved in creating the spasticity. So if you put the patient much more on physiotherapy, much more on lot of things, what will happen? The neural connections are disrupted. So when the neural connections are disrupted, आपस में बातचीत ही नहीं हो रहा और तुम रोज जाके माथापच्ची करेगा तो क्या ठीक होगा? इट्स जस्ट लाइक हस्बैंड एंड वाइफ रिलेशनशिप. झगड़ा हो गया, माफी मांगने की जगह तुम रोज एक बवाल खड़ा करेगा तो whether the things will come up. Instead of quarreling with wife, why don't you come to a peace treaty? Why you want to make a Ukraine? Why you want to create another Ukraine war, Russia and Ukraine war? Why don't you lower down your ego and finish the topic? Little compromise can just solve lot of issues. So let us compromise with the situation. And compromising is very simple. Putting things aggressively is damaging the patient. But putting peace treaty. So when we speak about anything about the recovery of the patient, is the peace treaty between the brain and the mobility. So that is what we require to obtain. Right? Now, again, the second thing is what? The brain is electrical and chemical connection. The action potential takes place. So action potential is what? The transferring of neurotransmitters. So here you can see this is synapse. And from here the membrane potential take place. So these are the calcium channels. So these transmitters come from out from here and they cross here and they cross the synapse and they reach here. Right? Am I clear? And this is called action potential. So when these neurons are damaged, अगर ये dead हो गया, so where there any signal processing will take place? This is the primary thing which has to take place. If these neurons are dead, who has the information of functioning? If they are dead, what will happen? So these are the things which we have to understand. So there is an imbalance of disruptions of motor pathways post-stroke also affects the balance of neurotransmitters, particularly GABA and glutamate. So we always do here with baclofen. We give gabapentin also, because in post-stroke cases there are chances of having what? Stroke. So whenever there is a high spasticity, always remember the patient may go into epilepsy. So it is always better that as a prophylactic dose, we give what? Gabapentin with nortriptyline and pregabalin. This is generally what we do. But other places they give only baclofen or leofen with other anti-epileptic drug. But here what we do, we mix up with gabapentin. One dose at night. And baclofen, as per the spasticity, BD or TD is given. 10 milligram BD or TD is given. Right? TD means triacetylene. So here you can see the muscle tone is hyperreflex, and you can see the increase of muscle tone here, right? And it is to hyperreflex. So reflex, the TDR, deep tendon reflex and all, if you put up, you will see the reflex is high. So that is the reason that if you put more exercise, more rehabilitative procedure in spasticity, more exercises we do, the patient will become more spastic. बात समझ में आया? Did you understand what I mean to say?
Yes, sir.
Everyone is able to understand what am I speaking?
Yes, sir. Yes, sir.
Yes, sir.
Yeah. So there are two types of neurons. One is upper motor neuron and one is lower motor neuron. Upper motor neuron is in the brain and lower motor neuron is in the spine. So we call it UMN and LMN. What we call it? UMN and LMN. So upper motor neuron and lower motor neuron. So the lower motor neuron is in the spinal cord is responsible for muscle contractions, become the hyperexcitable, and the absence of proper inhibitory signals from the brain. This hyperactivity leads to the involuntary muscle contraction and stiffness that characterize the spasticity. So here you can see upper motor neuron and lower motor neuron both are responsible for creating spasticity. Now it is an internal problem. So by treating externally, by putting lot of exercise, can we recover? Any physiotherapist over here? Shivani, Neha, am I right or wrong? Any physiotherapist can guide me? Any physiotherapist here? Any physiotherapist? कोई फिजियोथेरेपिस्ट है? There is no physiotherapist here. Any physiotherapist over here? Okay, we are not that famous in physiotherapy group. So, Imran or Pawar. Pawar, are you there? Sachin Pawar? Or Imran Mustafa? Can you hear me? Imran, can you hear me?
Yes, sir.
Imran? Imran,
Yes,
I have a
sir.
question. I have just small question of my doubt.
Yes,
This is
yes,
a
sir.
problem from upper motor neuron and lower motor neuron, right?
Yes, sir.
By putting the patient on aggressive physiotherapy and after he develops greater spasticity and stretching, can it resolve the issue?
No,
बार
sir.
बार
It will
stretch
increase
करने से will it resolve or will it become complicated?
complication होगा सर उसका.
हाँ?
Complication होगा.
Complication होगा, right? You are right. We'll develop a complication in this issue. Why?
More
We'll
spastic
develop
हो
a
जाएगा.
because it will become more spastic. Because the question is that it is a problem from the motor lesion, upper motor neuron to lower
And
motor
lower
neuron,
motor.
right? Until दोनों में सामंजस्य, until these two things becomes coordinated, neuroplasticity takes place, the spasticity cannot recover, right?
Cannot be
Even
resolved.
after surgeries, you will see there are various lot of conflicts we are finding and complications we are finding after the release of the tendon and all. So everything has to be integrated, supported, and recovered. Am I clear?
Yes,
Yes,
sir.
sir.
Yes, sir. Clear.
Yes, sir.
So now we see pathophysiology of spasticity, upper motor neuron dysfunction. Spasticity arises from the damage to the upper motor neuron, which controls the voluntary movement. The damage disrupts the signals from the brain to the spinal cord, leading to uncontrolled muscle contraction and spasticity. And that is why massage is contradictory to massage is not advised. Why it is not advised in CP patients and all? Because it is the spinal cord which is leading to the uncontrolled muscles and contraction and spasticity. Am I clear?
Yes, sir.
Sir,
Yes, sir.
Ayurveda people, sir,
हाँ?
बोले सर आयुर्वेद में बहुत से लोग पंचकर्म करवाते हैं सीपी में।
बेटा देखो सबसे बड़ा बात है कि इमरान देखो हम लोगों को ये मालूम है कि स्पास्टिसिटी क्या है,
जी सर।
कहाँ से स्पास्टिसिटी आया. It is a problem which has arise from the discommunication from the neuron, from the brain and the spinal cord neurons, like anterior horn cells and all, right? It's a disruption
Right.
of the pathway between two of the neurons. Now, you see, you are treating a local problem, but are you resolving the genuine problem? Are you treating the
No sir,
problem
not
of the
treating it.
brain and the spine?
No sir.
ये मालिश
So
करने से
only
या पंचकर्म करने से ये रिजॉल्व होगा ये इश्यू, बताओ आप.
local
यार
effect होगा।
आयुर्वेदिक डॉक्टर. हाँ,
Right sir. जी सर।
नहीं होगा सर.
आप आयुर्वेदिक डॉक्टर है,
नहीं
आप
होगा।
खुद ही बताइए पंचकर्म से ऐसा हो सकता है? राजेश जी आपका क्या ओपिनियन है?
सर मसाज से तो नहीं हो सकता सर इतना.
मसाज से स्पास्टिसिटी टूटेगा ना बढ़ेगा?
नहीं भरेगा.
बढ़ेगा ना मतलब
बढ़ेगा.
हाँ वाकई जी,
भरे, भरेगा सर.
ये बढ़ेगा ना घटेगा?
बढ़ेगा. भरेगा सर.
बढ़ेगा सर।
हाँ
बढ़ेगा बढ़ेगा.
बढ़ेगा, यू आर राइट.
Yes, sir.
बिकॉज जितने भी हम लोग का सबसे बड़ा प्रॉब्लम है BA MS से सब में न्यूरोलॉजिकल फैक्टर्स हम लोग को पढ़ाया नहीं जाता है,
सही बात है सर।
राइट?
ये
हम
बिल्कुल
लोगों को
करेक्ट है सर.
ये सब्जेक्ट्स के ऊपर टच ही नहीं हुआ हम लोग, राइट? हम लोगों ने वात पित्त कफ और बाकी चीजों एनाटॉमी फिजियोलॉजी सब ले लिया, बट व्हेन वी आर टीचिंग न्यूरो सर्जरी एंड न्यूरोलॉजी हम लोगों ने उस चीजों पर कोर ही नहीं किया. वी नेवर गिव ए इंटरेस्ट इन दिस सब्जेक्ट्स, राइट?
जी सर।
Did
यस
we
सर.
give an interest on this subject that what is spasticity, how it is developed? So when we don't know how it is developed, how can we recover it?
राइट सर।
हम लोग we are just throwing a arrow in the dark.
कहीं भी लग जाए।
क्यों गलत बोला मैंने? हम लोग अंधेरे में तीर मार रहे, राइट?
लग गया
वाकई
तो
जी
नाम हो
आपका क्या
जाएगा।
ओपिनियन है? इमरान
बिल्कुल सर
आप
सही
क्या
है
बोलना
आपका.
चाहते हैं?
बिल्कुल सही
मैं बोलना चाह रहा कि सर अंधेरे में तीर मारने से लग गया तो नाम हो जाएगा।
लग
है.
गया नहीं
बिल्कुल सही
लगा
है.
तो राम भरोसे.
नहीं बोले तो क्या है, कोई नहीं कर सका तो हम भी नहीं कर पाए।
भाई आपको तो कुछ
रेफर
होना
कर दो
नहीं है,
आगे
पेशेंट
बस.
अपनी स्पास्टिसिटी लेके घूमता रहेगा बस.
सही बात है। एक डॉक्टर से दूसरे डॉक्टर, दूसरे डॉक्टर से तीसरे डॉक्टर।
बस रेफर
घूमने
करते रहो.
और क्या कर सकते हैं बस.
नीरो में तो
इसलिए
सर ऐसा ही हो
ये
रहा है।
ये एक्चुअली इसलिए इस चीज को बंद करना है.
यस
ये
सर.
सर
साया
पूरे
कंक्लूड करो. माई ओनली
पूरे
थिंग
इंडिया
ऑफ
में।
डूइंग इज दैट my only interest to bring you to this subject and encourage people to study is that conclude करो चीजों को.
यस सर.
इसको ये अननेसेसरी टालने वाली चीज नहीं है, बिकॉज ही इज ए ब्रेड अर्नर ऑफ द फैमिली, राइट? एक फैमिली को बर्बाद करके हमें कुछ नहीं मिलने वाला. So that awareness has to come in the society that massage and all things cannot help because it is a lesson from the upper motor neuron to lower motor neuron dysfunctions. समझ में आया? सुनील आप तो आयुर्वेदिक डॉक्टर है, आप खुद ही बताइए आपका ओपिनियन क्या है?
सही
सर
है सर।
मसाज से समस्या बढ़ती है सर.
एक तो BAMS है ना,
यस सर.
तो मसाज से समस्या क्यों बढ़ती है बताओ?
सर अपने बार बार उसका
हाँ?
ऑक्सीजन लेवल जो बढ़ाते हैं तो ब्रेन के साथ उसका कोई कोऑर्डिनेशन नहीं हो पाता.
ठीक है, आप सी द क्वेश्चन इज दैट व्हेनेवर देयर इज इंजुरी इन द मसल द ब्रेन रिपेयर्स इट, राइट? ऑटो रिपेयरिंग मोड चलता रहता है. बट आप जब मालिश करते हैं तो इसमें रिपेयरिंग मोड तो है ही नहीं ना. Brain does not auto repair. There is no communication of
Yes.
repairing. So every day you injure your muscle, right? Every day there is injury in the muscle fibers,
Yes, sir.
cells, and everything. By evening you recover it. अब मालिश करते हैं in a healthy body, it is acceptable. But in a damaged body, in a lessened body, if you do all these things, will it recover?
No,
कोई
sir.
समस्या बढ़ेगी,
No, sir.
complications
बढ़
आएगा, right?
Yes.
क्यों गलत कहा मैंने? तो
सही है
क्या
सर.
सर?
एक तरह से स्पास्टिसिटी इज गुड इन द लोअर लिम्ब, क्योंकि क्वाड्रिसेप्स में जैसे स्पास्टिसिटी आता है, व्हेनेवर यू हैव स्पास्टिसिटी इन क्वाड्रिसेप्स यू आर एबल टू वॉक. बट देन अगेन फ्रॉम bringing from spasticity to recovery is a very difficult issue, because the muscle becomes spastic in quadriceps, you are able to walk. But the moment you take a circumambulatory walk, the gait posture is changed. What will happen? You will have a pressure on the knee, you will have the pressure on the hip joint, and there will be scoliosis. So if you recover from spasticity also by using Botox and all, by then you have osteoarthritis, avascular necrosis, hip osteoarthritis, slip disc, nerve compression. So you come out from paralysis, but you are what? Again not able to walk because of multiple problems which you have created. Am I clear to you at this point?
Yes,
Yes,
sir.
sir.
Yes, sir.
अखिलेश जी,
It
मेरी
is
बात
clear.
समझ में आई
Yes,
आपको?
sir. करेक्ट है सर, आपका बिल्कुल सही है सर.
मैंने गलत बोला?
बिल्कुल नहीं सर, सही है
क्योंकि
बिल्कुल.
we are putting more pressure on one leg while walking, right?
Yes,
It is
sir.
tight. So you are putting more pressure of the body, you are putting more weight on the body, right?
Yes,
And
sir.
muscles are so giving excessive weight on the knee and the hip joint and the spine. तो क्या होगा? एक तरफ scoliosis,
Yes, sir.
disc degeneration,
बिल्कुल सही.
disclasion,
सही है.
sciatica, न्यूरोपैथी, और सबसे बड़ा प्रॉब्लम है कॉन्ट्रेक्चर. तो प्रॉब्लम कहाँ है? द प्रॉब्लम इज इन अपर मोटर न्यूरॉन एंड लोअर मोटर न्यूरॉन. So instead of addressing the situation, what are we addressing?
लोअर मोटर न्यूरॉन.
यू आर नॉट एड्रेसिंग एनीथिंग. कहाँ से लोअर मोटर न्यूरॉन को एड्रेस कर रहे हो? आप तो कुछ भी नहीं कर रहे हो, आप तो बस
मालिश कर रहे हैं.
मालिश भी नहीं कर रहे, आप तो राम जी की भलाई कर रहे हो.
राम भरोसे छोड़ रहे.
राम भरोसे नहीं. इन इंडिया इट इज सेड, राम राम जपना पराया माल अपना. जो मन में आया वो करो, और जो होगा देखा जाएगा. So that should not be happen. As a physician, our moral duty is what? The recovery of the patient. And it should be conclusive. आपसे नहीं बन पा रहा है, कोई बात नहीं, थोड़ा दिन रेफर कर दो, थोड़ा दिन इसको इधर ट्रीट होने दो, फिर बाद में आप उसको मैनेज करो. वी विल गाइड यू. लेट द केस बी कंक्लूडेड. और जैसे जैसे आप केस कंक्लूड करते जाते हो, द मोमेंट यू स्टार्ट कंक्लूडिंग द केसेस, व्हाट विल हैपन? योर कॉन्फिडेंस, योर फेम, your name will increase in the society, right? You recover one paralysis patient, I tell you, the whole society will know you have recovered it. You know, just because of the recovery of paralysis patient, I became world famous. The disrupted motor control pathways and pathophysiology of spasticity. Now again we have to study this thing. The spinal cord induced damage to the upper motor neurons disrupt the descending pathways that control the voluntary movement. These disruptions lead to the imbalance of excitatory and inhibitory signals within the spinal cord, contributing to spasticity. Right? The damage of the upper motor neuron causes an increased excitability of the spinal cord motor neurons, leading to overactive stretch and reflex and increases the muscle tone. Now, when you give lot of exercise, you do muscle. So you damage which area? You damage both the lower motor neurons and upper motor neurons. So at the end of the day, problem बढ़ा या घटा? So you get altered sensory input. So the sensory inputs are altered. The sensory pathways that arises from information about the muscle length, tension to the brain are also affected. The altered sensory input contributes to a misinterpretation of sensory information and further exhibiting the spasticity. So this is the answer of what? Massage. सुनिए ये बात लिख लो, अल्टर्ड सेंसरी इनपुट. हम
Yes, sir.
मालिश करते हैं तो ये स्लाइड का फोटोग्राफ खींचिए. स्लाइड तो आपके पास है ही है, बट जब आप मालिश करते हो तो आप एक पेशेंट को एक्सप्लेनेशन दे सकते हो कि भाई आपने एक दूसरे को तमाचा मार दिया. अब उसको तमाचा मारने के बाद क्या होगा? एक दूसरे को गालियां बकोगे तो झगड़ा होगा. झगड़ा होने से बात बनेगी नहीं, बात बिगड़ेगी. सो व्हेन यू आर स्पीकिंग अबाउट द अल्टर्ड सेंसरी इनपुट, the brain is having more tension now, right? So when you tense, already the brain is in tension, right? After having a stroke, the brain is in so much tension that he cannot maintain his own stress level, right? There is oxidative stress, there is higher stress level, the maintenance, the coordination, सब बर्बाद हो गया. Everything has been lost. The muscle control has been lost. And ऊपर से आप जबरदस्ती उसको रिकवर करने की कोशिश कर रहे हो. It is not possible. So physiotherapy is required. Everything is required. Ayurvedic medicines like Brahmi Vati, Smriti Sagar, Ras Rasayan, I always Ashwagandha, all these are supportive. But along with this, the communication between the upper motor neuron and the lower motor neuron and the pathway of the signals, ascending signals and the descending signal has to be very fine. So there should not be disruption of the signals. ऐसा कुछ भी मत करो जिससे सिग्नल आपस में बर्बाद हो जाए. आप ऐसा कोई भी झगड़ा मत करो जिससे मेरे और आपके बीच में अनबन हो जाए. इन हिंदी इट इज वेरी वेल सेड, रहीमन धागा प्रेम का मत तोड़ो झटकाए, और जोड़ने से भी ना जुड़े, और जुड़े तो गांठ पड़ी जाए. You understood what I said? There was a very good poet, a Muslim poet in India called Rahim. He said the relation of love should not be broken with misunderstanding. But if it is broken once, you cannot rejoin it. But if you rejoin it, there is a knot. It cannot be like before. Am I clear to all of you?
Yes, sir.
Yes,
The
sir.
person, see, I am speaking Hindi and English both because there are many Hindi speakers from India, and I'm trying to interpret it in English also, right?
Thank you, sir.
I hope
मुझे
all.
है.
I hope the English readers, you and all, they don't have any problem with my conversation.
No, sir. It's okay.
No, sir.
You
Yeah,
all are
another,
okay.
sir.
I'm asking the forum.
Yes,
Nigerians
sir.
and all, they are having any. You are having any problem with my conversation language?
No, sir. No, sir. Thank you, sir.
You are able to understand what am I speaking?
Yes, sir.
Are you able to understand what am I speaking, Nomi?
Yes, sir. Thank you, sir.
You will always say only one word. Thank you, sir. Nigerians, I only heard one word from Nigerians. Thank you. Other than this, they never say anything. They only say amen and thank you. These are the only two words in 9 years I have heard. Inshallah, amen and thank you. They never say fourth word to my life. This is the greatness of Nigerians. They never say anything.
अभी तो दर्द वाली गोली खानी पड़ेगी.
So post-stroke progressive spasticity developing neurological characters is characterized by increasing muscle tone and exaggerated reflexes. So when you take tip tendon reflex and all, you will see the reflex is increased, the tone is increased. The result from the damage to the brain motor control pathways, leading to imbalance between excitatory and inhibitory signals. While spasticity often emerges shortly after a stroke, it can progressively worsen over time and make daily activities challenges. So now there is two problems we face. What are the problems? The degenerative problems, the increase of the tightness of the muscles, and damages in the muscle. Hello? Yes. ये न्यूरो हॉस्पिटल है. लाइन काट दीजिए साहब, ये रिसेप्शन है हॉस्पिटल. हाँ, आप किससे बात करना चाहते हो? ये हॉस्पिटल है सब। So, whenever you have this, post-stroke spasticity manifests differently based on locations of severity of the stroke. For instance, individuals with expertise spasticity, these phones. I'm sorry, I am the only one to receive these phones. Good. Post-stroke spasticity manifests differently based on the locations of severity of the stroke. For the individuals with uh, right side of the body and vice versa, they have more spasticity. Spasticity of the upper limb can lead to clutched fist. Clenched fist means like the tiger claw like this, right? Wrist drop and everything. And restricted upper arm movements because it develops frozen shoulder. It develops a very difficult frozen shoulder, right? In the lower limbs, it can cause stiff and rigid legs, difficulty walking, and increase in the risk of falls. Right? Functional limitations. Post-stroke spasticity poses significant challenges to daily life, affecting mobility, dexterity, self-care activities. For example, an individual with spasticity in the upper arm may struggle to button a shirt or use a fork to eat. He can do nothing. His hands are like what? This much, bus. He cannot do anything. So it's a lifelong problem you are created for the patient. If your starting is not good, or if you are not working in a planned way, अगर आपने नाव को सही तरीके से नहीं चला, if you don't take the boat in the right way, if the sailor is not sailing the boat in the right way, what will happen? What will happen?
Wrong direction. Wrong direction.
क्या होगा? पानी तो दिखेगा, किनारा नहीं मिलेगा. You will see the water in the mid of the sea, but you will never get the what?
Bank.
Bank of the river. किनारा नहीं मिलेगा. कश्ती कोई डूबती पहुंचा दो किनारे पे, तुमको अपने आप ही किनारा मिल जाएगा. So when you recover a paralysis patient, you'll understand lot of things. The recovery itself will teach you the love of brain and love to God. And that is why I always say, Swami Samartha Maharaj ki jai. Why? Because when you say these words, the good neurotransmitters, the good neuro inspirations, all it comes from to you. So if your transmitter is good, if your receiver is good, the nature itself gives you a lot of information. Because you all have a very good mindset. You had a pain for the paralysis patient. You have a pain for the neurological disease. Out of 1,000 people with 3,500, 5,000 online students, 70, 80 people have come. We started with only 10 people of this class, right? Now we have come to 80. Why? Because we know that, yes, there is a solution to this problem. And every one of you can solve this problem. Only it is a matter of time. Nothing can happen today, right? Gradually, everything will happen. Am I wrong, Pava?
No, sir.
Sachin,
Right.
am I wrong?
No, sir. You are right, sir.
Can anything happen today? No. Gradually, everything will happen. But till then, अब जैसे you were asking me what is multiple sclerosis, मैंने multiple sclerosis का slide ही बना के आपको दे दिया. Now you know what you can do, what other doctors can do, and what I can do. You know that information very well. And then you can read the books, you will get the same information. Instead of giving you a book of multiple sclerosis, I gave you 30 slides which you can understand, read, and guide the patient.
Yes.
If the patient is also asking, write him notes and give him.
Yes, sir.
I do the same thing. If anyone is asking me question, I make the slides and I give him. You read and you decide.
Yes, sir.
You understood? The
Yes, sir.
best solution. The patient wants so many questions. So you write me a question. I'll give you one slide. You study that slide and topic over. हाँ, एकदम सही कॉन्सेप्ट है. एकदम मैंने यही नियम बना रखा है. कल इतने लोग स्पास्टिसिटी के ऊपर पूछ रहे थे, लो भाई आज स्पास्टिसिटी पढ़ा, टॉपिक ओवर. हाँ, रोज पूछ रहे थे मालिश करना है, ये करना, कौन सा पॉइंट मारना है, क्या करना, हाल बाल राल। तो मैंने बोला लई बाल गंगाधर तिलक, लाला लाजपत राय एंड बिपिन चंद्र पाल। बाल हो गया हेड, लाल हो गया हाथ, और पाल हो गया पैर, बिपिन चंद्र पाल। तो बाल लाल पाल तीनों पढ़ा दिया मैं। तो दिस टेक्निक इज कॉल्ड बाल चंद्र तिलक, बिपिन चंद्र पाल एंड लाला लाजपत राय। So the technique name is Bal Lal Pal. So it was a very famous thing in 1947 Indian struggle. They call it Bal Lal Pal. Bal Chandra Tilak. So head, Lal means लाठी से मार खाया, लाला लाजपत राय. So उसको स्पाइन पे चोट
लाल
पड़ा
लाल
इसलिए
पाल।
पैरालिसिस हुआ. So it becomes Lal, and Pal means
लाल पाल।
लोअर लिम. बिपिन चंद्र पाल, उसको पाँव में मार मार के उसका पाँव को नक्की कर दिया. तो इस थ्योरी का नाम निकल गया बाल लाल
बाल
पाल. बाल मीन्स बाल गंगाधर तिलक, लाला लाजपत राय एंड बिपिन चंद्र पाल. May peace raise to this soul, but this theory is called Bal Lal Pal. And it is a true when you read the Indian history, because we were the one who appeared for IS interview. So this was there. It is a topic of 19 civil disobedience movement under there was two revolution in Congress, two division. One was active and one was non-active. So when non-active revolution was there, this was one of that part. नॉन गांधी जी वाले वादी एक थे, गांधीवादी एक थे, बाल गंगाधर तिलक अरविंदो घोष एक थे. तो ये बाल लाल पाल है. ये नॉन
इट इज
वायलेंस
द
से नहीं मानेगा उसको. जब तक ब्रेन को सबक नहीं सिखाओगे, जब तक उसको लाइन पर नहीं लाओगे, until the brain is brought into coordination, under the muscles are brought into coordination, under the signals are processed, recovery will not take place. So the recovery has to take place only with neuroplasticity, neurogenesis, angiogenesis, neuroplasticity, good synaptic connections, and that is why I call it French kiss, the kiss of the husband and wife. Presynaptic neuron and postsynaptic neuron has to kiss each other. जितनी बढ़िया किस होगी, जितना प्यारा चुम्मा होगा, उतना जल्दी रिकवरी होगा. You understood? It is called the kiss of the neurons. So the neurons, the neurochemicals from the presynaptic area where the membrane potential was there, वहां से chemical release okay. The gap which is there is called synaptic gap. And दूसरी न्यूरॉन यानी पोस्ट सिनेप्टिक न्यूरॉन्स के पास जाएंगे. It is called the kiss of the husband with the wife. So until the kiss is very good, until there is a very good French kiss, paralysis cannot recover. Am I clear?
Okay, sir.
ये तो नया फंडा पता चला किस
हाँ?
नया फंडा पता चला कि इसका.
किस ऑफ द न्यूरॉन. इसको फिर बाद में हम लोग बोलते हैं फैंटम म्यूजिक ऑफ द न्यूरॉन्स. I'll show you one slide where there is only audience, but there is a maestro. He plays like this, and all the audience plays with him. It is called the phantom music of the neurons. The neuron has a music. इसी को नाद साधना बोलते हैं. When you understand the music of the neurons, you go to the deep trance, and that is called what? Samadhi. The moment you are able to hear the music of the neurons, you reach the highest level of spirituality. इसी को बोलते हैं परम ब्रह्म की साधना. And in Quran it is said Anal Haq. So where is God? Where is Nad? Where is another Nad? Where is Brahma Nad? It is all in the neuron, the music of the neuron. इसी को नाद बोलते हैं. इसी को गायत्री में पूर्ण साधना कहा गया. It is why it is said, the moment you chant, the neuroproteins are gone, G lymphatic system recovers, and then here also one role comes that when there is a higher spasticity, there is a neurochemicals. So this neurochemicals damages they created more complications. Tau proteins and all are generated, and at the end of the day, because of spasticity, because of oxidative stress, unnecessary stress, the patient what? Becomes more stressful, more spasticity, more post-stroke complications, Parkinson's, Alzheimer's, all that take place in a patient. And more important is depression, giving up approach. So most of the thing you will see in paralysis patient, they give up the approach of recovery. Am I right or wrong? And this is the neural basis of depression. So I will be teaching you what is the neural basis of depression, right? The wrist drop and trigger claw deformity are common clinical manifestation of spasticity. Wrist drops occurs when the extensor muscles of the wrist are weakened due to spasticity and flexor muscle causing the wrist to drop. The tiger claw deformity, on the other hand, involves spasticity of the flexor muscles of the hand, causing the fingers to curl into a claw-like position. So this is one of the most difficult status we find in what? The tiger claw. The flexor muscle becomes what? Spastic. And the extensor muscles becomes weak. So एक ताकत, the dominancy of the flexor muscle, extensor muscles over the flexor muscles create what? Wrist drop, and it becomes like a tiger claw. यानी टाइगर की तरह हाथ हो जाता है, बिल्ली की तरह हाथ हो जाता है. उसको क्या बोलते हैं? बिल्ली का हाथ. क्या बोलते हैं? बिल्ली का
हाँ
हाथ या टाइगर का हाथ. इसको हम लोग अपनी सीधी भाषा में बोलते हैं बिल्ली का हाथ, हैंड ऑफ द कैट. It becomes like this, like this. Can you see me?
Yes, sir.
yes
So this is where you are making a mistake. Since the beginning of the plan is not correct, the end stage is like this. That is why I said, do not compromise with the treatment of the patient. Otherwise, एक हिंदी में गाना है, क्या था? मेरा जीवन कोरा कागज कोरा ही रह गया. आया था पैरालिसिस लेके, प्लास्टिसिटी लेके चला गया. I came with placidity, you gave me spasticity. So, whenever you work with any patient, remember you have a clinical responsibility of what? A good recovery. You will be always known for your recovery, not for spasticity. गाली देगा spasticity करेगा तो. सर ये क्या हो गया? तो हम बोलेंगे सारे सपने कहीं खो गए, हाय ये क्या से क्या हो गए. Right? You understood what I said?
हाँ सर.
I lost all my dreams and see what has happened from where I came. समझ में आया?
हाँ सर.
सारे सपने कहीं खो गए, हाय पैरालिसिस से स्पास्टिसिटी हो
हो
गए,
गए.
सारे जॉइंट सारे डैमेज हो गए, जवानी में बुढ़ापा आ गया. So, in one language, you can complete this topic. What? जवानी में बुढ़ापा.
Yes.
दस 45 कितना हुआ? 165 ना? सो 160 और 160 40 200 205. ठीक है ना? ठीक है. उसी को डेट ठीक. ठीक है Stem cell surgery offers a promising avenue for the treating progressive spasticity by addressing the underlying neural degeneration. Stem cell possess the ability to differentiate into various cell types, including neurons, glial cells, which are essential for the restoration of neurological functions. So this paragraph speaks of what you are saying, right, Galaji?
Yes, sir.
It helps you to restore the functions. You have damaged the cells. Now, by putting stem cells and cloning from the father cell to the mother cell, helps you to recover the progressive spasticity.
Okay.
These therapies hold potential for replacing damaged neurons and promoting hexagonal regenerations in the spinal cord, thereby improving motor control and reducing spasticity. Moreover, stem cells can secrete neurotropic factors that support the survival and growth of exciting neurons, further enhance neural repair. So, can be repaired, right?
Okay.
It can be what?
Cured. That means
Repaired. The body
okay.
has the capacity to repair, right?
Yes.
Provided we know how to repair it. Am I right or wrong?
Yes, sir. You're right, sir.
The stem cell therapy is a conjunction with brain mapping, allows the targeted delivery of the stem cell to specific regions of the brain and spinal cord by affected by the spasticity. Now, if you mix it with brain mapping and stimulation, they get a direction, right? To guide a direction to that place, communication to that place, by which what? The spasticity can be recovered. And the spasticity recovery means paralysis recovery. So integration of brain mapping, neuroacupuncture, brain stimulation, baclofen, gabapentin all helps in recovery of the patient, including physiotherapy.
Okay.
Right?
सर ये
Yet
वीडियो वीडियो
training. हाँ बताइए और
आपका
तेजी
वीडियो पॉज हुआ सर
हाँ
आपका वीडियो बंद हुआ सर
मेरा वीडियो बंद हो गया अच्छा
हाँ,
हम लोगों को पता ही नहीं चलता क्या बंद हुआ क्या चालू हुआ और चालू भी कैसे करना है ये भी मालूम नहीं
हाँ,
आ
हो
गया
गया सर. हाँ, सर.
यस सर
हो
आ
गया
गया
सर.
सर
हाँ यू हैव टू गाइड मी फॉर एवरीथिंग अरे भाई कोई लैपटॉप लेके बैठा करो यार क्लास में सारा दिन मेरे को एडमिट करना पड़ता सब कुछ मेरे को करना पड़ता मैं कैसे करेगा हाउ मच वालिद विल टू अरे कम से कम सुनील तुम थोड़ा बहुत सीख के ये सब करो यार
ओके
लैपटॉप है
सर.
तुम्हारे पास बैठ के एडमिट कोस्ट बनो और करो एडमिशन करो ये करो वो करो मैनेज करो यार सारा मेरे मत्थे मार देगा तो कैसे चलेगा हम भाग जाएगा क्लास तुम जानो तुम लोग का क्लास जाने Upper motor neural lesions can manifest several clinical signs, including hyperreflexia, spasticity, and more important is clonus. So clonus is the involuntary movement of the muscles. So you will see in paralytic patient when you make them walk, their hands and legs are doing like this, clonus. So that clonus has to go away. And Babinski's sign. So we'll give you an special class on Babinski's sign. The lessons normal inventory control of motor neurons leading to exaggerated reflex and increased muscle tone. So you can understand the Babinski sign, DTR deep tendon reflex, all become hyper reflex, यानी exaggeration, यानी पाँव को ऐसे जाना है, you will get hyper reflection like this. ठप 60 degree जाएगा, 80 degree जाएगा. If you beat on the deep tendon, we'll take a class of deep tendon reflex, so you can understand more nicely about the neural lesson and deep tendon reflex, right?
सर
Rehabilitative
कॉन्ट्रास्ट
therapies focus on restoring upper motor neuron function and crucial in managing spasticity. These therapies improve to improve motor control coordination, the function independence. Techniques like constant induced movement therapy and task specific training can be effective in facilitating neuroplasticity and promoting functional neuro recovery. So that is why I say physiotherapy, conservative, non-invasive brain stimulation, and a correct planning and correct pathway will conclude the case at the earliest. So you cannot say I'm against physiotherapy because we have physiotherapists. They only manage our clinic, right? There is an orthopedic doctor. There is a medicine specialist. There is a radiologist. So everyone has to work for the recovery of the patient. And evidence-based neurorehabilitation strategies based on evidence-based practices are essential for managing spasticity. These strategies often involve the combination of physical therapy, occupational therapy, speech therapy, tailored to individual needs, targeting specific motor impairments, improving muscle tones, and maximizing muscle functional abilities are the key aspects of neurorehabilitation. So all these are called what? Stem cell therapy. Everything goes inside into one topic. What is this? Neuro recovery. What it is called?
Neuro recovery.
Neuro recovery. The recovery from the neuro.
Okay.
The definition should be such a way that अगर न्यूरॉन से रिकवर हो गया तो टॉपिक ओवर बस and that is called neuroplasticity.
Okay. Neuro.
Now, lower motor neuron dysfunction can contribute to spasticity by impairing muscle strength and coordination. This can lead to muscle atrophy. Now, another problem which you have in the shoulder muscles like posterior deltoid, anterior deltoid, middle deltoid, the weakness of the muscle, the shoulders will fall down and it leads to subluxation. And these impairments can affect the functional mobility and daily activities. This can lead to what? हाथ गया तो काम गया बस अब तुम्हारा हाथ काम नहीं कर रहा तो क्या करेगा अपाहिज हो गया वही अगर ठीक ढंग से प्लानिंग करो तो why paralysis should be in the society? Paralysis is never the part of society. We have created paralysis because of our ignorance, because of our ego, because of our understanding, and we are the one who can recover it very nicely, very beautifully, and in a proper way. So according to me, 80% of the cases can be recovered if you and me both coordinate together. बात समझ में आया?
Yes, sir.
यानी अपर मोटर न्यूरॉन लोअर मोटर न्यूरॉन सही से कोऑर्डिनेशन करेगा तो पैरालिसिस कहाँ टिकेगा? If the communication is okay, the neuroplasticity takes place, then there is no contracture. Spasticity induced muscle shortening can lead to joint contracture. This is the biggest problem we are facing right now in paralysis. Causes a fixed deformity. Now there is a fixed deformity in the ankle joint and all. There is no movement in the ankle joint. It will become fixed deformity. So before anything which becomes a deformity and fixed deformity, we should recover the patient. So any delay will create more problems, more death of neurons, more spasticity, more damage. बर्बादी से अच्छा आबादी करना चाहिए. Where you are going to gain nothing. If you don't have the proper knowledge, spasticity will lead to contracture. If it goes to contracture, it's a fixed deformity. उसके बाद तुम बोटॉक्स मारो या बोटॉक्स मारो या एनआईबीएस करो. फिक्स मतलब फिक्स. That is why it is said, रहमन धागा प्रेम काम मत तोड़ो झटकाए और जोड़ने से भी ना जुड़े और जुड़े तो गांठ पड़ी जाए. So if you break the love affection between you all and you try to rejoin it, it can come to some coordination, but it will lead to spasticity and contracture. It can never become like this. So from the planning, from the onset of the treatment, you should go it in such a way that nothing should happen like this. There should not be any complication in the what case. So in the all the super specialty hospitals, what we do? We discharge the patient in hemodynamic stable condition and we say you can go to any rehab hospital or anything. Our job is over because we cannot recover paralysis. It is not our job to recover paralysis. Our work was to make you stable. You are stable. You go to other centers for recovery of the paralysis. Am I clear to all of you?
Yes, sir.
So,
And then there is lot of muscle spasm, pain, deformities, contractures,
हाँ बना
and all these things what? Damages and further damages and progressive damages. And all this leads to what? The
है
deformities and dysfunctions
और
and contractures, and the problem is never resolved. So here you can see this is a AFO, which is given in foot drop spasticity. Contractures and deformities. Lower motor neuron dysfunction in spasticity contributes to the development of limb deformities such as contractures and joint stiffness. This dysfunction disturbs the balance of muscle activity, leading to persistent muscle shortening and limitations in movement. So that there is a muscle shortening, fixed deformity, and limitations of movement, and it is a painful movement. यानी कोई भी मूवमेंट करते हो तो वो दर्द जड़ित होता है. Am I clear?
yes,
So
sir.
whenever you have a foot drop, we give you a splint, AFO. It is called AFO. Am I right? Foot ankle orthosis, right? Instead of strengthening the common peroneal nerve and this medial nerve and giving PRPs and all these things, instead of improving the nerve, we fix it by giving AFO. So it is also correct, but then further recovery of the muscle is required. Otherwise, the person will have lifelong what? Foot drop. So foot drop is another complication of post-stroke cases, right? And the spasticity can also lead to upper limbs, leading to the deformities such as fixed elbows. The elbows becomes fixed. This difference can significantly impact daily activities, impacting self-care, social interactions, and overall quality of life. So the ankle and hand will become like this. It becomes fixed. The shoulder becomes fixed, and it becomes very difficult to recover. Post-stroke spasticity is a complex neurological condition that can significantly impair motor function and quality of life. Optimizing patient outcomes covers a comprehensive approach that considers the role of neuroplasticity, brain mapping technologies, and personalized rehabilitation strategies. Neuroplasticity refers to the brain's remarkable ability to reorganize, adapt following the injury or disease. By harnessing the power of neuroplasticity, rehabilitation interventions can promote functional recovery and minimize the impact of spasticity. So, with the help of all the plant techniques, we can minimize the function MRI, the transmagnetic stimulation, and EEG, right?
electroencephalogram
And so on the basis of EEG and all, we do what? Brain mapping with the help of 1.5 Tesla images of where is the damage and how to recover the damage. We put the needles, we stimulate it as per the maps we have developed, and then the functional recovery comes to the patient. Provided you it as a permanent contracture or so therapeutic rehabilitation and conservative treatment is most important in overcoming the spasticity and paralysis, and it is called neuroplasticity and rehabilitative strategies. Am I clear?
Yes, sir.
yes sir
Pathophysiology of differences in spasticity. Upper limbs often presents with a flexor pattern, leading to difficulty with reaching, grasping, fine motor tasks. This can lead due to predominance of flexor muscles in the upper limb and the involvement of corticospinal tract, which controls the involuntary movement. So corticospinal tract is responsible. That is why I say all the pains, all the stimulations, all the maps are required to recover a patient. If you say which pain is important, so now you see what's the complication, and this is a typical complications which cannot be overcome by one thing. This is the real theoretical and practical part. So if you don't know the theory, today a person gave me a phone call and he said, I want to attend the class on 8th. I said, you are most welcome. He told to Sandeep. And then he said, I'll pay the money on EMI. I said, are we sellers? No, we are not the sellers of the pain. We can give the numbers also, but the problem with the people is that you people trouble those people so badly. In past, we had the experiences that you give them 100 phone calls. What is this? What is that? Even Sandeep is receiving 50, 70 phone calls a day. What is that? What is this? And this, he says that I'm so tired of answering the question. He was complaining me this. Baba, what you want, you just be specific. Why are you questioning so many things? If you don't want, don't take. If you want to approach, you approach. If you have different approaches, you take different approach. No one is bounding you to do any approach anywhere, anything.
Yes, sir.
Am I right? Lower limb spasticity manifests an extensor pattern, hindering the walking and ambulations. This attributed to the predominance of extensor muscles in the lower limb and involvement of the corticospinal tract, resulting in increased muscle tone. And comprehensive approach to diagnosis management is essential. This involves accurate assessment of spasticity severity, identifying the underlying causes, utilizing the combination of pharmacological, non-pharmacological, rehabilitative interventions tailored to individual needs. So it is very much tailored. Every problem has a specific problem and every problem has a specific solution. So it is 9:37.
अरे उससे चिल्ला के बात नहीं करना, हम लोग बात करते हैं, जानते नहीं है कमाई से इससे बात।
We'll continue the class, the slides from tomorrow. We'll put it for the
फिर
question
बोलते हैं अपना
answers.
पढ़ाई लिखा में
One.
ध्यान,
Hello.
अभी घुस के रहेगा तो आदमी चिल्लाएगा ही नहीं। इधर आ, इधर आ।
Where is the mute?
ये छोटा वाला मोबाइल किसके पास है रे?
Yes. You may ask me questions now. I put myself to the panel for asking questions. Ask. You have 20 minutes to ask me questions. You may ask me what questions you want. So, you can ask me questions, please. Ask me questions.
सर हेलो हेलो
Tell me.
सर कांस्टेंट इंड्यूस मूवमेंट थेरेपी क्या है? हेलो
Ask me questions, please. I'm hearing. Please tell me your questions.
सर व्हाट इज कांस्टेंट इंड्यूस मूवमेंट थेरेपी?
Huh?
कांस्टेंट इंड्यूस मूवमेंट थेरेपी
क्या बोल रहे हैं मेरे को समझ में नहीं आ रहा. Can anyone
सर
interpret what he's
कांस्टेंट,
speaking and who's speaking?
सर इमरान है।
Hi Imran, tell me what is your question. Imran, your voice is not clear to
माय
me. Please
क्वेश्चन
tell
इज
me.
माय क्वेश्चन इज व्हाट इज कांस्टेंट इंड्यूस मूवमेंट थेरेपी?
नहीं समझ में आ रहा है इमरान, बिल्कुल नहीं समझ में आ रहा. आप लिख के दो.
देखिए
सर और बात कर रहा हूँ. हेलो हेलो सर.
हाँ. Sanjay Naik, there is a question. Plant-based stem cells. I don't know about plant-based stem cells. Because how to procure stem cells which are identical. Stem cells means what? You have to take out from bone marrow. So what is plant-based stem cells? I never studied about it. So I give up my hands. Plant से भी stem cells निकाला जा सकता है. There may be a new technique, but I don't know about it. And how far this is identical in replacing our body stem cells, our body cells, and cloning and neurogenesis, angiogenesis is possible? No. See, constant induced movement therapy. That is, I don't know what is constant input. That what I don't know. What is this movement therapy? Constant induced movement therapy.
सर
Anyone knows about constant induced movement therapy? कोई जानता है इसके बारे में? Or tomorrow I'll tell you. I'm just making a lecture on this topic. Tomorrow I'll give you a lecture. Let me study for the whole night. But according to me, NIBC is the best approach. Stimulus in the brain creating neuroplasticity is the best approach of recovery
Sir,
because it reduces the time of recovery.
sir, I am having question, sir. Parvinder, sir. Parvinder.
Parvinder ji, please tell.
Sir, in lower limb spasticity, what steps we will do, sir?
See, it depends from case to case. First, we have to identify which area of the brain is damaged. Then we have to study the nerve conduction velocity. Then we have to study the EMG. And then we can conclude कहाँ डैमेज है और कितना डैमेज है और कैसे रिकवर करना है. It is just like a car insurance. First, you have to make a क्या बोलते हैं ना उसको, क्या बोलते हैं, गाड़ी का इंश्योरेंस क्लेम करते हैं तो वो क्या आता है ना, एक आदमी
वकील
सर्वेयर
इंस्पेक्टर आता है।
सर्वे करता है
सर्वेयर.
सर्वे।
सर्वेयर. So let the survey of the paralysis be done, and according to the survey we can claim the damages.
Okay, sir. Thank you. Thank you.
सर हर एक स्ट्रोक और न्यूरो के पेशेंट में
सचिन, आवाज क्लियर नहीं आ रही.
अभी आ रहा है सर? हेलो
सचिन,
हेलो।
अब आ रहा है, बोलो बाबा.
हाँ सर, हर स्ट्रोक के और न्यूरो के पेशेंट में स्टेम सेल्स थेरेपी
मैं तो सब जगह स्टेम सेल मारता हूँ. आई
ओके
लाइक. मैं तो
ओके
सब जगह ठोक देता हूँ. ऑस्टियोआर्थराइटिस से लेके, रीजेनरेटिव से लेके, स्ट्रोक से लेके, बैक पेन से लेके,
ओके
सब जगह ठोक
अच्छा
देता. आई एंजॉय. मुझे अच्छा लगता है. बोन मेरो से नहीं निकाल के, ब्लड से निकाल के ठोक. मसल्स को
ओके
पावर मिलेगा, पैरास्पाइनल स्ट्रेंथन होगा, रीजेनरेशन प्रोसेस विल टेक प्लेस, सो इट इज ऑलवेज गुड.
ओके
इसका
सर
साइड इफेक्ट क्या, कुछ भी नहीं है. अंडर एसेप्टिक प्रोसीजर इट हैज नो साइड इफेक्ट.
ओके
See, now in this part, what you have said is very correct. But the question is that it is a upper motor neuron and lower motor neuron. The communication, see, they have given a very good reply. The movement of the non-constant part, the word which is moving, you are constant in, right?
यस
You constant the normal part, you allow the non-constant part to move. But here there is again a question that whether the what you communicate to the brain.
यस
What are you communicating to the brain? That is important. The most important part is the communication with the brain and the spinal cord. Whether the communication is correct or whether the communication is not correct.
राइट सर
So I know this, but I don't want to answer this question because according to me, my approach is different. My approach is सबका साथ, सबका विकास, सबका साथ.
ओके
You understood?
यस सर यस
My saying is I am a follower of Modi in this condition. So if anyone asks me how to recover paralysis, I will say सबका साथ, सबका विकास और सबके साथ. Every muscle has to recover, every neuron has to active, every part of the muscle has to progress, and paralysis and disruption and disparity of the society will go away. Am I right?
यस सर
तो इसलिए इसको क्या बोलते हैं, सबका साथ, सबका विकास, सबके साथ.
Sir,
ओके
You understood?
sir,
You understood what did I
yes,
say?
sir. Sir,
You understood?
sir, Manish है.
Tell me, Baba.
हाँ, सर ये स्पैस्टिसिटी ऑफ मसल और लूज हो जाना मसल, इसके बारे में कुछ
आपकी आवाज
बताइए.
पूरी कट रही है, मैं कुछ भी नहीं समझा. I did not understand anything.
सर स्पैस्टिसिटी मींस जकड़ जाना,
हाँ,
मसल्स
अकड़
का,
जाना, पूरा टाइट हो जाना. It becomes tight,
जकड़ जाना
muscles becomes
और
tight.
लूज हो जाना, मतलब लूज हो जाते हैं मसल्स ना, पहले से लूज भी हो जाते हैं, तो इसका
उसको फ्लेसिड
क्या
बोलते हैं. उसको फ्लेसिड बोलते हैं.
दोनों में क्या मतलब फर्क और कॉम्बिनेशन, या इसमें बारे में क्या
लूज हो
जान
गया
सकते
तो
हैं इसके
कोई
बारे
काम में नहीं रहा, स्पास्टिक हो गया तो टाइट हो गया, दोनों ही खराब.
दोनों का रीजन सर
दोनों का रीजन
क्या
स्ट्रोक
हो
है,
सकता है?
डेथ ऑफ न्यूरॉन्स।
ओके,
ये तो न्यूरल कम्युनिकेशन है। द मसल,
तो
यू हैव टू अंडरस्टैंड हाउ द मसल्स आर फंक्शनिंग। द न्यूरल फंक्शनिंग इज
ओके,
इम्पोर्टेंट।
ओके,
आप समझे मेरी बात? द न्यूरल फंक्शनिंग ऑफ मसल्स आर इम्पोर्टेंट। हाउ द मसल्स आर फंक्शनिंग in a normal way, that has to be brought back. So कैसे काम करता, that is important, right? हाँ, there is a question from Farid. Farid, अस्सलाम वालेकुम, please tell me.
वालेकुम सलाम।
हाँ, वाहे बरकतुल्लाह, वाहे बरकतु।
Sir, I want to know if neurodynamic technique can be helpful to recovery spasticity of upper limb.
So this is what we are saying.
Neurodynamic.
Brain stimulation and all these things are neurodynamic techniques because they are dynamic in nature. Brain is dynamic. It's not static. So all this what we are speaking, muscle contraction and all these things which we are speaking is not a dynamicity. We are not obtaining a dynamicity in the recovery. Brain, muscle, spine, neurons, all are dynamic. But when we speak
Yes, sir.
about this therapeutic module, what I see, I have read 30 years back, still we are following the 30, after 30 years also we are following the same syllabus. Before 30 years also we used to give baclofen. After 30 years also we are giving baclofen. Before 30 also we used to implant baclofen pump. After 30 years also we are implanting baclofen pump. But that is not the solution because there is no solution to this problem until we solve it in a right way. So what you are saying a dynamic therapy, this is a dynamic therapy. You are very correct for it that we have to take it dynamically in a dynamic form.
Okay, sir. Thank you.
I hope you understood what I mean.
Okay, sir.
Gradually you will understand more. It is called neuroplasticity. In one day you will not understand. You will only understand one line today. Spasticity is a problem from upper motor neuron, lower motor neuron, tightness of the muscles because of the disruption of the communication between husband and wife. Husband is brain, wife is spine. The quarrel between two creates the problem with the children, and this quarrel of the children is tightness, angerness, excitement, overreaction of the muscle. So you can understand husband and wife quarrel is spasticity. I think you can understand because you may be having, how many wives you have, Farid? 3 or 4?
Only one.
Farid, how many wives? 3.
Only one.
Only one? How one? You should have 3
One.
wives, Baba.
great.
3 wives. Then you can understand this answer very nicely. Only with one wife you cannot understand. Farid, you have got to have 3 wives.
I have a
You should marry 3.
camera
You should go to
everywhere.
Malaysia
Okay.
and you should marry 3 wives.
Sastry sir, I have a drone camera everywhere.
Hello,
Drone
sir.
camera? Oh, wives are the very
Drone.
big
Drone
CBI.
camera
Yes, they
everywhere.
are
I
drones.
can't
They
move.
are everywhere. They will not spare you. Wives are the very big row agent. They will take out one hair from your cloth. From where this hair came? They are the best row agents. The best row agents in the world. The IB agents, Intelligence Bureau, are the ladies. They can take out anything from you.
Hello, sir. Hello.
1 minute, I had a phone call. Hello. 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 Yes. Neuro Hospital Reception Center. सरी माँ हाँ
Hello, sir.
पांड्यन टेल मी पांड्यन बोलो
Hello.
क्या बात है भाई
हेलो
हाँ
सर, ये
सर
one minute
पैरालिटिक
after
पेशेंट के लिए
another 1 minute Vikas ji Pandyan is to say something then you
पैरालिटिक
come to me
पेशेंट के लिए अपन
1
मसाज
minute
नहीं
Vikas ji
है क्या?
Vikas ji.
हाँ
Pandian is asking one question. Then we'll come to you.
हेलो
Just 1 minute. Pandian, 1 minute. मेरी बात
Sir,
सुनो.
okay, sir.
हाँ. Pandian, tell me what is your question?
Sir, as a baclofen is a muscle relaxant, is used to
Huh?
give temporary relief only, no, sir. How it is helping in stroke?
See, what are you telling the question? Please be clear to it. क्या बोल रहे हैं Pandian?
Sir, we are using baclofen for as a muscle relaxant, so it is giving
हाँ.
only a temporary relief.
So
So,
see, we are only speaking about the symptomatic treatment. We are not speaking anything of permanency. We are not speaking about neuroplasticity. We are saying baclofen will reduce the spasticity, otherwise it will become contracture. तो और हम करें क्या? हमारे पास कुछ है ही नहीं, तो हम ये तो दे, कम से कम जो है वो तो दे. We don't have anything other remedies. I'm not a manufacturer of drug, or I'm not a discovery of the drug. Baclofen is a proven drug for spasticity, so we have to give it.
but this brain mapping is far better than this baclofen drug, right, sir? So,
Baclofen is a drug which we give for spasticity. And if we don't give it spasticity, it will become contracture.
so this baclofen is also important in all these stroke patients, right, sir?
Not only in stroke patient, all the other patients, spinal cord injury, and many patients, spastic paralysis. There are a lot of cases where spasticity is developed. So everywhere it is given baclofen, especially in spinal cord injury. When we see there is a bone TB, there is cock spine. Again, you develop this. So there is there, Baba.
So is it
Baclofen is
possible to treat a patient, neurological patient with spasticity without this drug, sir?
see, if baclofen is given, why do you want to stop it? First, you recover the patient. Then you can taper the drug of baclofen. Because most of the patients who come in our clinic has been already advised baclofen. Why to stop it now? But when you see baclofen is creating flaccidity of the muscle, if excessive muscle relaxant and baclofen is creating flaccidity in the muscles, then you should taper it and stop it. बट जब तक स्पास्टिसिटी है बैक्लोफेन तो देना ही पड़ेगा, गाबापेंटिन बैक्लोफेन देना ही पड़ेगा.
Okay, sir. Thank you.
हेलो सर.
हाँ बोलिए
हाँ सर,
विकास जी.
ये पैरालिटिक पेशेंट के लिए मसाज करना ही नहीं है क्या फिर?
सुनील बताएगा ये बात, वो आयुर्वेदिक डॉक्टर है. सुनील,
यस
आर यू
सर.
देयर सुनील? हाँ.
यस सर.
विकास जी, विकास वसंतराव
हाँ
राहनी जी पूछ रहे हैं.
हाँ,
इज
ये
आस्किंग ए क्वेश्चन, व्हाई
पैरालिटिक.
मसाज इज पैरालिसिस पेशेंट में मसाज करना चाहिए, नहीं करना चाहिए? नहीं करना चाहिए तो क्यों नहीं करना चाहिए? व्हाई मसाज इज कॉन्ट्राडिक्टरी इन पैरालिसिस, एंड इफ नॉट, व्हाई? यू आर आयुर्वेदिक डॉक्टर, यू आंसर दिस क्वेश्चन. वसंत राव जी, सुनील जी आपको इसका जवाब देंगे. इसे सीनियर आयुर्वेदिक डॉक्टर वो आपको बताएंगे. हाँ सुनील जी, प्लीज टेल अस.
सर, अपर मोटर न्यूरॉन और लोअर मोटर न्यूरॉन में उसका कम्युनिकेशन नहीं हो पाता. और हम लोग लोअर मोटर न्यूरॉन पे मसाज करते हैं, तो अपर मोटर न्यूरॉन के साथ कोई कम्युनिकेशन नहीं है. इस वजह से वो आपस में अपोज हो जाता है, इस वजह से वो ठीक
देखो,
नहीं हो
नहीं नहीं
पाता.
नहीं नहीं नहीं, देखो आप लोअर मोटर न्यूरॉन में भी कुछ नहीं कर रहे. लोअर मोटर न्यूरॉन तो स्पाइन में है, आप तो मसल के साथ खेल रहे हैं. यू आर नॉट कम्युनिकेटिंग विद द न्यूरॉन्स. सुनील, यू आर नॉट डूइंग एनीथिंग विद द न्यूरॉन्स, यू आर जस्ट डूइंग ए लोकल मसाज.
यस सर.
वेदर झगड़ा में झगड़ा कर रहा है तुम. Because how neural communication is taking place by putting an extra pressure on the muscles, you are giving a disrupted signal in the spinal cord. उसे ब्रेन के ऊपर वो प्रेशर जा रहा है, तो उल्टा सीधा काम हो रहा है. ये तो उसकी बीबी मेरे घर. पांडियन की बीबी तेरे घर, है ना पांडियन? पांडियन कहाँ भाग गया?
Yes, sir. Yes, sir.
So he is saying, तेरी बीवी मेरे घर. You understood what he meant to say? इसको इंग्लिश में ट्रांसलेट करके बताओ, तेरी बीवी मेरे घर. Pandit does not know Hindi. So, Pawar, translate him in English and tell, तेरी बीवी मेरे घर.
Your wife is at my home.
Your wife is in Sachin Pawar house. He was like, Pandyan, be careful what Sachin is saying. Your wife is in his house. So, if you go to the wrong thing, you will get a wrong reply. If you give a wrong signal to the brain, you will get a wrong reply. By putting excessive pressure, you are saying Pandian wife in your house. I told him you translate in a third language, third person. He used the first person language. He said Pandian wife in my house. Now Pandian and Pawar fight. I have nothing to do. That is called spasticity with massage.
हेलो सर. हेलो सर.
हाँ बताओ.
हाँ सर, ये नेचुरोपैथी में मसाज, पैरालिसिस में मसाज और स्टीम रिकमेंडेड करते हैं.
देखिए, आयुर्वेद हो या एलोपैथी हो या कुछ भी हो, द बेसिक्स ऑफ द पैरालिसिस शुड बी क्लियर. बेसिक्स क्या है? इस इज अ ब्रेन स्ट्रोक, इज a neural communication. The neurons has to be communicated. The signals has to be propagated. This is the right method. आपने उस कारण, जिस कारण से बीमारी का उत्पन्न हुआ है, द रीजन, द कॉज ऑफ द डिजीज, आर यू एड्रेसिंग द कॉज ऑफ द डिजीज और यू आर क्रिएटिंग ए प्रॉब्लम इन द डिजीज? दैट यू हैव टू आइडेंटिफाई. It is a problem between the neural communication, right? So by putting excessive pressure on the muscles, will the muscles recover? No. Rather, if you see most of the allopathy book and neurological book, they say massage is contradictory to what? In a paralytic patient. I'll give you a full lecture on this. एक दिन पूरा पकाएगा तुम लोग को मसाज के ऊपर. Why massage is contradictory to paralysis. और सचिन पवार और पंड्यान का झगड़ा कराएगा, उसका नाम ही लिखेगा सचिन, पंड्यन वाइफ इन सचिन हाउस. लेक्चर का नाम होगा पंड्यन वाइफ इन सचिन हाउस. द टेक्निक विल बी पंड्यन वाइफ इन सचिन हाउस. अभी सचिन बोला ना, मेरी
Sir,
बीवी तेरे घर. पंड्यन, बी केयरफुल. सचिन तेरी वाइफ को देख रहा है. That is what we call the lower motor neurons are looking for the upper motor neuron. Upper motor neuron is looking for the lower motor neuron, and this signal has to pass to the muscle. If everything is good, the muscle activity is good. If everything is, something is wrong, muscle activity cannot take place. छोटी सी बात. अब इसका तुम राय का पहाड़ बनाना चाहता तो बना लो. The communication between the brain to the spine to the muscle. It is a flow of communication. Any disruption, any noise in this communication cannot recover the muscle and functional recovery. So this has to be corrected, and the correction is called neuroplasticity. Am I clear?
Yes, sir.
नहीं तो ओमपाल सिंह बोलेगा मेरी बीबी उसके घर. So, to clear the concept, neuroplasticity is the answer, and the neuroplasticity can be generated very well with the plant techniques, non-invasive brain stimulation, proper gait training, proper techniques are there. If we apply proper techniques, neither there will be spasticity, nor contractures, nor complications. Right time, right treatment, right motive stimulation, right mapping, topic. What? Over. नहीं तो पांड्यन की वाइफ ओमपाल के घर, ओमपाल की वाइफ पांड्यन के घर. अब दोनों जाने, दोनों का झगड़ा चलते. समझ में आया ओमपाल? Did you understand me, Dr. Liu? I am saying his wife in his house, his wife in his house. The interchange of his wife will create a clash in the communication. So keep your wife in your house, enjoy with your wife, don't exchange your wife, else both of you will be in trouble. So Ompal Singh, Pandian, and Rahane was thinking, Vikas Vasant Rahane was thinking of interchanging their wife. And Pava was ready that send your wife to my house. So it was going to be a what? A complication. So I said, keep your wife, don't exchange your wife, be happy with whatever you have. Otherwise, there is a deficit. समझ में आया शकील? अपनी बीबी अपने घर. So what is the summary of this topic? My wife, my house. If you exchange your wife, what will happen? If you fight with your wife, if you exchange your wife, if you quarrel with your wife, there is disharmony in the muscles. This disharmony can go to any extent. Spasticity, contraction, जो बवाल करना करते रहो और फिर बोलते रहो मेरी बीबी उसके घर, और बाद में जब डाइवर्स हो जाएगा तब तुम देखेगा हाथ पांव काम नहीं करता, घर का खाना कौन बनाएगा, who will cook your food? You go in the kitchen and cry and then you will say यार थोड़ा लड़ाई झगड़ा ही ठीक था, खाना तो नहीं बनाना पड़ता. So every husband has to respect the wife, CNS has to respect the PNS, PNS has to respect the CNS, muscle has to work in coordination with CNS, PNS, and muscle bacha, PNS wife, CNS husband. Central nervous system has to coordinate with the PNS, PNS has to coordinate with the muscles. तब घर में शांति. अगर तीनों में अशांति हो गया तो उसकी बीबी मेरे घर, मेरी बीबी उसके घर. Now keep exchanging your wife and enjoy the music of the house. Are Ompal, you tell me, how can you adjust with the wife of Pandyan and how your wife can adjust with Pandyan? Possible? After 20 years of your marriage. Okay, Surya Narayan Das, I'm asking you one question. Surya Narayan Das, can you hear me? Unmute your mic.
Yes, sir. Namaste, sir.
Namaste. Can your wife adjust with Galaji?
No, sir.
And Galaji's wife can adjust with you?
No, sir.
Possible?
Definitely not, sir.
So if that is not possible, then spasticity also recovering by all this aggressive technique is not possible.
It's problem understood, sir.
मेरी बीबी उसके घर, उसकी बीबी मेरे घर, not possible. They have to be adjusted in your house and you have to adjust with your wife. Bring a proper communication. मेरी बीबी मेरे घर. Topic over. This is how you recover what? Paralysis. अब आपकी बीबी को जो चाहिए वो लाके उसको दे दो. Topic over. उसको साड़ी चाहिए. She wants sari, she wants diamond ring, she wants earring, one necklace. Give and topic over. So whatever nerve wants, whatever muscle wants, give them proper communication. Have healthy communications between neurons, both CNS, PNS, and muscles. Neuroplasticity will appear. Paralysis will recover. Spasticity bye-bye.
Understood, sir.
Understood?
Understood, sir.
So the saying in Hindi is, Meri bibi mere ghar. And the best way is, we'll understand more about neuroacupuncture, brain mapping tomorrow. For today, Pandyan is worried. His wife is calling him. See? And Ompal Singh का wife बार-बार उसको बुला रहा है. ऐ जी सुनते हो? क्लास कब खत्म होगी? शकील शादीशुदा या नहीं है? Are you married, शकील? शकील, are you married? ओए कवा, कश्मीरी. देखो, कवा का नाम से बात ही नहीं करता. Oh, Shakil ji, can you hear me?
Yes, sir.
Are you married or unmarried?
Unmarried, sir.
Huh?
Unmarried.
Unmarried. Okay. So take the picture of Shakil and put in the Facebook. 2 crore rupees dowry, 20% my commission. Finally, we got one bachelor in this company. At least semi Zoom class का पैसा तो निकलेगा तुम्हारा dowry से. So I request everyone to take the photo of Shakil and put in the Facebook and demand 2 crore rupees. Good boy, good doctor, handsome, good looking, never married, and what you called fully functional, certified by Pandian, medically certified by Pandian, fully functional, and what you called एक और वर्ड बोलते हैं ना हम लोग
Sir, recommended
सेकंड
by MK Sastry.
नहीं सेकंड हैंड को नहीं बोलते फर्स्ट हैंड को क्या बोलते हैं एक तो सेकंड हैंड होता है और एक फर्स्ट हैंड होता है ना जो शादीशुदा उदा नहीं
Virgin,
होता किसी न
virgin,
किसी के
sir.
लाइन नहीं
फर्स्ट
Virgin,
ओनर
virgin,
सर,
sir.
फर्स्ट ओनर।
वर्जिन हाँ
Virgin,
वर्जिन बॉय फुल्ली वर्जिन बॉय नेवर मैरिड लड़कियों के पीछे डोरा नहीं मारा है 2 crore रुपीज डाउरी 20% कमीशन वागड़े इसका फोटो ले लो और डाल दो फेसबुक में फाइनली एक हम लोग को बैचलर मिल गया इस क्लास में अब इसको फेसबुक पर डाल दो देखते हैं 2 crore रुपया आता है कि नहीं आता है कश्मीरी बॉय गुड लुकिंग वर्जिन बॉय नेवर मैरिड डॉक्टर है ना शकील 40 लाख तो मिलेगा तुम लोग का 2 का शादी हो जाएगा तो मेरा बुढ़ापा आराम से कटेगा हमको क्लास लेना नहीं पड़ेगा पवार शकील का शादी करा दो ओके शकील एग्रीड शकील एग्रीड you
No, sir.
get him one Chinese girl Shakil will marry a Chinese girl but he wants 2 million Indian currency no 200 million Indian currency 20 million currency for marriage Shakil's demand is 20 million 20% is my commission so everyone take the photo and put on the Facebook शकील तुम्हारा डिमांड हो जाएगा फिर पहली बार हमारे क्लास में एक नया जवान लड़का आया virgin boy so paralysis is a virgin don't get married to so many girls right if you marry it with so many girls it will become a what what will happen if you marry to 4 wives what will happen Walid
सैंडविच सैंडविच
हाँ क्या होगा
सैंडविच सैंडविच हो गया
सैंडविच होगा शकील भाग गया देखो क्लास से 4 वाइफ से शादी करेगा तो सैंडविच हो जाएगा दैट इज व्हाई से recovery of paralysis is not a sandwich technique it is a beautiful technique recover it beautifully obtain proper knowledge obtain proper recovery show your results teach the society paralysis is over it's a very good marriage and invite us to this marriage ceremony of paralysis ऐसा नहीं हो शकील की तरह तुम उसकी 4 शादी करा दो हम लोग को तो फायदा है इसकी 4 शादी होगी तो 8 crore का 20% मिलेगा हम लोग को वो जाने उसका काम जाने बाकी so spasticity is created by 4 marriages instead of that do 1 marriage okay and do that proper marriage and continuously marriage you is saying very beautiful sentence I have been married once and I'm continuously married and I am ready to bear my wife I don't want second wife so if you want to remain a happy life and you want to recover paralysis, go with Dr. Liu theory or Dr. Rajesh Vakre theory. Wife पक पक करती रहे मेरे को उसका बकबक का साथ नहीं देना आई डोंट वांट टू बी इन कॉन्फ्लिक्ट विथ माय वाइफ अच्छी शादी करो अच्छा जीवन जियो और अपनी वाइफ को फ्रेंच किस दो फ्रेंच किस मीन्स द किस ऑफ द neuron that is called action potential give proper action potential give proper signaling proper massage not massage message कि proper message, not massage, proper message to the brain, proper message from the nerve, paralysis, राधू, मतलब paralysis, हरि बोल. Okay?
Yes, sir.
Clear?
Clear, sir.
नहीं क्लियर है तो 4 शादी कर लो, समझ में आ जाएगा पैरालिसिस और स्पास्टिसिटी क्या है. गो प्रैक्टिकल. Surya Narayan Das gave me one advice. That those who don't understand, tell them to get for marriages. They'll understand what is paralysis. Surya Narayan Das technique. You have only one way. Either you get married to one and continuously marry. Don't marry 2 wives. But if you want to learn paralysis and spasticity practically, marry 4 wives and you will understand. है ना रानी जी? अब 4 शादी कर लो, आपको समझ में आ जाएगा मालिश करने से स्पास्टिसिटी
बराबर है सर.
घटती है या बढ़ती है. एक पेशेंट का करके देख लो, पता चल जाएगा. एक का कर लो, अच्छे से मालिश करके रगड़ दो उसको, बड़ी ताकत से रगड़ दो और देख लो कितनी बढ़िया स्पास्टिसिटी आती है. फिर जब एक में समझ में आ गया कि नहीं करना है तो मत करो, नहीं तो कर लो फिर दूसरी शादी, तीसरी शादी भी कर लो. फिर समझ में आ जाएगा आपकी चूल क्यों उड़ गए. एक ने चूल उड़ाया, दूसरा क्या उड़ाएगा पता नहीं. वाकड़ी जी की टेक्निक ठीक है. एक बीबी काफी बीबी. वो तो भाग गया, पांड्यन तो क्लास छोड़ के भाग गया, शकील भी भाग गया, हो गई हमारी क्लास ठप. सब भाग गए, सब लड़के लोग भाग गए. पांड्यन भी शादी नहीं किया, शकील भी शादी नहीं किया और सब भाग गए. सब रिफंड के लड़के. You understood? Know me? You understood what I said? Be happy with your one husband. Don't get 4 husbands. So non-invasive brain stimulation, neuroacupuncture, gait training, conservative, stem cell therapy, 5-6 approaches are very good approaches. Apply, recover, direct, topic, over. Close. So we close this topic. वाहेगुरु जी दा खालसा, वाहेगुरु जी दी फतेह. सर्वे भवन्तु सुखिनः, सर्वे भवन्तु निरामया, सर्वे भद्राणि पश्यन्तु मा कदाचित् कदाचनः. May Lord bless each one of you. May grace of the Lord comes to you. Om Shanti, 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 Shanti. Om Shanti. Thank you so much. May you all be happy. My prayers and blessings are with you.
Thank you, sir.
May you all do wonderful things in your clinic. And don't marry. My final advice: don't marry with 4 wives. Ampal Singh told me right now, sir, I don't want to marry 4 wives. 1 wife.
Sir,
is
Lal
enough.
Pal. Thank you so much, sir.
Lal Pal. Bal Lal Pal. Bal matlab head. Lal matlab लात. लाला लाजपत राय को स्पाइन में चोट पड़ी थी इसलिए पैरालिसिस हुआ था. और पाल मतलब हाथ. हाथ गए. बिपिन चंद्र पाल के हाथ तोड़े गए थे. So they were the founders of communist theory and against Britishers. So it was a famous theory of Congress 1 and Congress 2. So Congress 2 was with Bal Lal Pal and Congress 1 was with Mahatma Gandhi. Congress 2 became Netaji Subhash Chandra Bose. Congress 1 became महात्मा गांधी कांग्रेस. तो बाद में जो हुआ सो हुआ. कहानी जिंदाबाद. शास्त्री जी मुर्दाबाद. टॉपिक ओवर. वाकड़े जी की दूसरी शादी मुबारक हो.
थैंक यू सर.
थैंक यू भी बोल दिया. वाकड़े जी आपकी दूसरी शादी मुबारक हो. सबने थैंक यू बोल दिया.
सर मत फंसाओ सर, एक तो वैरी है.
तो वाकड़े जी की दूसरी शादी मुबारक हो. थैंक यू बोल दिया.
एक ही तो वैरी है सर, बस हो गया.
Thank you.
Thank you.
Thank you, sir.
Thank you so much, sir. Thank you, sir. Good night.
Good night, everyone.
शादी मुबारक हो.
बस हो गया एक.
वाकड़े जी मजा आ गया. जोक ऑफ द डे पवार. वाकड़े जी की दूसरी शादी मुबारक हो. सबने थैंक यू बोल दिया.
मत फंसाओ सर, मत फंसाओ.
वाकड़े जी बहुत बहुत मुबारक हो आपको दूसरी शादी. सबने थैंक यू भी बोल दिया. थैंक यू भाई. थैंक यू ऑल ऑफ यू. गुड नाइट. ओम शांति.
Thank you so much.
Thank you so much, sir.
Thank you very much. Good night, sir. Good night, everyone.
Good night.
Good night.